My name is Dr. R. Stuart Fowler. I was trained in medical school at University of Utah. Then I did my residency at Mayo Clinic Rochester in obstetrics gynecology. I was in private practice for a couple of years. Then I got invited back to Mayo Clinic Arizona to be a consultant in gynecology. And from that time forth, I became the hormone expert at Mayo and would have hundreds of patients referred to me with hormone questions and problems. Hormones became popular in the early 80s in the United States. And by that time, we had discovered that if we gave estrogen alone, which was the initial approach in the 60s, it caused women to get uterine cancer to a very high degree. And so that became a problematic area for many years until we discovered that by adding progestin into the mix, that totally negated that risk. And then in the 80s, we recognized that hormones were really beneficial for heart disease, and it became recommended even for a preventative treatment in that area. This became quite controversial, and in 2002, with the Women's Health Initiative, it came out and suggested that women were at increased risk of getting both breast cancer and heart disease. Millions of women were immediately concerned and thought that they had been misled starting hormones for not only symptom relief, but for preventative health as well. Well, it was very apparent for years that women would have a tremendous response to estrogen from symptom relief. The main symptoms that women would develop, not having estrogen continued after menopause, are hot flushes during the daytime and night sweats at night, and vaginal dryness that would cause problems with intercourse. Well, hot flushes and night sweats, they in themselves were significant enough to disrupt women's lives that they would get personality changes along the lines of becoming moody and felt like they could, quote, chew people's heads off and start crying at the drop of a hat. And so what we discovered was that if they got night sweats, they got sleep deprivation, specifically REM sleep deprivation. You have to have about 20% of sleep in REM sleep so that you're fully refreshed when you wake up the next day. If you don't have that, then women are tired, fatigued, don't have the mental stamina, lose focus, concentration. And by giving estrogen therapy, which we referred to as ERT therapy if they had a hysterectomy, meaning estrogen only, or hormone replacement therapy, given estrogen plus progestin if they had a uterus in place to protect the uterine lining as discussed previously, then their hot flushes and night sweats could be fully eradicated and they would have a tremendous change in their sense of well-being. But when the Women's Health Initiative came out, millions of women went off hormones. And we found out later that study was released at apparently the director of the NIH before doctors had been able to review the results and make the appropriate statistical calculations and such. So a number of years go by, approximately 10 or so, and the data is reanalyzed and it's found that there are confounding variables, and as well the data was misinterpreted. And it was found that estrogen was not increasing breast cancer rate. And it was found that estrogen was not increasing heart disease, with the exception of the following. If a woman has heart disease, meaning coronary artery disease, plaque and such in the vessels, and she has started on hormones at that point, so this would be somebody typically in their late 60s or 70s, they do have increased risk of having heart attacks. Whereas women that started hormones from menopause onward had a protective value, as we had told them all along, and had a lower rate of getting heart disease. So it's taken a number of years to get women to understand this, that it went both ways as far as heart disease. And it was fortunate that giving estrogen was not causing breast cancer. So now the only concern we have with using estrogen and or with progestin is that there's increased risk of blood clotting tendencies, meaning anything from a blood clot in your leg to your pelvis to pulmonary embolus to having a stroke and a heart attack. And every once in a while we hear about a young woman having a heart attack. healthy young women? Well, it turns out they're almost all on birth control pills. And obviously, birth control pills are a much higher dose of estrogen than hormone replacement therapy. So the risk of a woman in the menopausal years developing a clot is extremely low. There are risk factors, and if they have risk factors for getting blood clots, then most of the specialists, meaning my area of gynecology and my colleagues, believe it's not a good idea to give women estrogen in that setting, meaning those that have risk factors, either clotting factors or have had a prior blood clot. But everyone else has very minimal risk of being on estrogen, plus or minus progestin. Then came the question that there was a hormone called testosterone. And the general public always thought that was a male hormone, and women didn't need testosterone. Well, for years we had one type of testosterone in an estrogen called Estratest, and it was approved by the FDA for women that had refractory hot flushes and night sweats, meaning didn't have full relief of their hot flushes and night sweats on estrogen alone. They could be on estrogen plus testosterone, called Estratest, and it has worked very well over the years. But then further data came out, particularly regarding different forms of testosterone. And almost all forms of testosterone cause a trough and then a peak. Trough and a peak. And that's true of oral testosterone, testosterone put on in the form of gels or creams, or testosterone put sublingually. And it turns out that the testosterone receptors do not respond well to seeing that peak and trough. And then we noticed a marked difference in response of women using pellet therapy to get their testosterone.
When I see patients for the first time, they're often very overwhelmed. They don't feel well, they're not motivated, they feel like their health goals are kind of insurmountable. A lot of people wonder if something is wrong with them and their hormones or if this is just normal. So menopause and what I call menopause are normal signs of aging. The ovaries and the testes decide to take a back seat and stop working like they did in your 20s. And this is absolutely normal. So generally speaking, there's a handful of symptoms that patients feel when their hormones are low. For men and women, it's very similar, but for women, generally speaking, it's hot flashes, night sweats, trouble sleeping, new onset anxiety and depression for no real reason, some vaginal dryness, pain with intercourse, amongst other things like brain fog and fatigue, trouble recovering from exercise, weight gain, the list goes on. Very similar for men, I call it menopause instead of menopause, and they experience very similar things. Oftentimes the weight gain, trouble sleeping, anxiety, lack of motivation, lack of response from exercise, obviously lower libido, and sometimes erectile dysfunction. Women are often surprised when I tell them they need testosterone therapy, and often it scares them. They think it's a male hormone only. They're afraid they're going to grow muscles and a beard, and that is just not true. Women have more testosterone in their body than they even do estrogen. So they actually need a good amount of testosterone to function the way that they should. Testosterone therapy for women often has to be monitored very tightly. If it's a little too low, you feel off. If it's a little too high, you feel off. So we keep things really tightly monitored so that you're right in that optimal range and you feel your best. What I find really interesting about hormones is they tie into so many other facets of your health. Primarily stress response. And stress plays a role. It's quite inflammatory for the whole body. So it's interesting to find out that testosterone therapy is anti-inflammatory. Having your hormones balanced and receiving a bit of testosterone can mitigate the effects of stress. Patients are relieved once they have their pellets. They realize that their ability to manage stress is just so much better. This ties into their cortisol production and their overall stress response. So hormones play a huge role in your ability to manage stress and move forward.
Over the years, I've been seeing 4,500 to 5,000 patient visits per year. So to date, I've done approximately 70,000 insertions. I'm a physician assistant doing the SottoPelle method of hormone replacement therapy for 14 years. Most of my career before that was in gynecology and infertility. One of the things that's really had me gravitate to the area of women's health care and hormone replacement is that most of my patients were healthy and happy, and if they weren't, I could do something about it. We deal with men, women, transgender patients, women who are premenopausal, women who are postpartum with depression, all sorts of individuals that can be benefited by hormones. Some of our patient subgroups are patients with Parkinson's. Parkinson's patients, their motor skills are helped tremendously with testosterone, their ability to move and get around. We have a lot of previous Hall of Fame football players who've had traumatic brain injury who are coming in who are getting pellets. And some of these guys have been near suicidal, some of them almost unable to function mentally, who are now living really amazing, healthy lives.
We found out that women get such a tremendous benefit from their estrogen plus testosterone therapy that their husbands are the ones that recognize when it's starting to wear off, and they'll encourage them to go get their pellets placed. But there's more to it than that. For instance, SottoPelle is a company started by Gino Terra, a good friend of mine. And SottoPelle means under the skin in Italian. He was born in Rome, Italy. And he was the first one to introduce pellets to the western United States. There are other people that had used pellets and started in the eastern United States. So one of those is Don Gambrell, who is a true expert. I put on a hormone meeting while I was a consultant at the Mayo Clinic down at Hotel Del Coronado one year, and I invited Don Gambrell to come down. And it was the first time anybody out here that had even heard of pellet therapy. In fact, I was the first one, practically one of the, well, let me say, I was probably one of the very first ones to give bioidentical estrogen in Phoenix. Because at that time, all women were on Premarin estrogen. And Premarin, as you know, comes from horse urine. Prem stands for pregnant mares, Premarin. So when I started using bioidentical estrogen, meaning estradiol, I took flack from most of the doctors in Phoenix, but I had a strong voice because I was a male physician. Well, now, you don't hear of women asking for Premarin. They're all asking for bioidentical hormones. When this therapy was introduced here in Western United States, it became very apparent that women were achieving excellent results. In fact, to the point that when I would see women at Mayo Clinic that I felt had testosterone deficiency, I sent them over here to Gino Terra to have pellets. And they did not just a little bit better, it was like lightning compared to a flashlight when I would give estrogen plus topical testosterone or sublingual testosterone or in creams, other forms, that the response was just night and day. I mean, it was so clear that the pellet therapy was working better.
So initially when patients come to us for hormone therapy, they either know a lot about it or they don't. The first thing we do is a detailed consultation to figure out what their needs exactly are, and we do detailed blood work. We're looking at hormone levels, we're looking at stress levels, and the thyroid. All things kind of play a role. We're trying to get a whole picture of what the patient really needs. Once we see the blood work, we can really determine whether it's testosterone, estrogen, both, or a number of things. We will then offer them some sort of hormone therapy.
And what pellet therapy does is placed under the skin in the subcutaneous tissues, and blood vessels form around it, so that the more active a person is, meaning the faster their heart is beating, the more testosterone they get. And that was found to be a key determinant in getting the testosterone receptors to turn on in women. So by giving it that way, we found out, in comparison just to estrogen alone therapy, that women had a tremendous response in regard to their sense of well-being, mainly because testosterone receptors are abundant on the skeletal muscle system, all the way from your feet all the way up to your head. And when you're on testosterone, you get invigorated. It does something to the muscles that you no longer have need for afternoon naps. You recover faster from exercise. The second thing that women feel is that the testosterone stimulates their genital tissues so that it's easier for them to reach orgasm and have stronger orgasms. The third benefit we found is the testosterone stimulation in the frontal, temporal, and parietal lobes of the brain, where women got an increased sex drive. But not only that, they got increase in their focus, concentration, and memory. Plus, we found that when women are in their menopausal ages, they would get a mixture of anxiety and depression symptoms, and those symptoms would work out. In fact, it's found to be so obvious that it works so well that psychiatrists in our area in Phoenix, who are very aware of pellet therapy with testosterone, are now referring patients here if they have simple anxiety or depression tendencies without other factors associated. And the vast majority of those women get relief of those symptoms. So it causes a mood evenization.
This really allows them the motivation, the stamina, the willingness to start making more small goals. Oftentimes, once they're feeling well, we start with movement, we start with diet, and we make little changes that feel like nothing now that they're optimized and feeling better.
Not only do I have sisters, and sometimes sisters and brothers, I've got mothers and daughters. I have mothers who may be in their 50s or 60s, and even, yes, some women in their 30s and 40s who do have a hormonal deficit. A lot of times that's mostly testosterone, and we're adding that in, and we'll add the estrogen in when they reach menopause. And these people are going to be telling their daughters about it, and they're going to be telling their siblings and their friends. Probably 85% of our business is word of mouth, people who are happy, who are telling other people how happy they are, and getting the rest of their friends and families in. We have a lot of previous Hall of Fame football players who've had traumatic brain injury who are coming in, who are getting pellets. And some of these guys have been near suicidal, some of them almost unable to function mentally, who are now living really amazing, healthy lives.
Well, a lot of women knew about the sex drive, and that is the most even, consistent response. But a lot of women didn't know about the energy level. They were so fatigued that they didn't have energy to exercise, so they would start gaining weight.
Having your hormones optimized allows you, even helps you, to want to be more active. Your joints don't hurt so much. You can go out, you can exercise. Not only are you doing it, you're getting results, you're recovering faster. You'll be able to build that muscle that you lost. You'll be able to get that endurance back. You'll feel better in general. You won't be the couch potato at 6:30 at night. You're turning those hormones back to normal levels, and it's having just an entire ripple effect on your lifestyle and the way you feel.
Their relationships with their spouses were falling apart because they had zero sex drive, and the cognitive effect. So women will come in and say all the time, the sex drive is great, but the concentration and mental acuity is wonderful. They couldn't think and concentrate, and it was affecting their jobs. So I consider it the best kept secret in women's healthcare, pellet testosterone. We know that testosterone has a great deal of value for women, particularly and really only those that are found to have low levels of testosterone in their bloodstream. And it's surprising that even women in their 30s can show up with low testosterone levels, and particularly in the 40s, and it's very common in the 50s. I mean, we're talking women come in and we get their tested, and the test can even detect that testosterone level. There are lots of women that have zero testosterone, like a 90-year-old. And when we give those women testosterone, it has amazing changes. I mean, they get their life back. It is the most best kept secret in women's healthcare, but some women are still so concerned about taking it because of things they hear about the side effects.
There are a couple common side effects associated with hormone therapy. Generally speaking, for women, men tend not to experience as many. For women, the first thing they may experience is a little bit of breast tenderness, similar to that before a menstrual cycle. And this is safe, it's not dangerous, it's just a little bit of a flux of estrogen. The second one they experience, I joke with my patients, it's usually hairy and horny. Horny is a great thing, hairy is not. And the hairy they experience is the occasional stray chin whisker. And a lot of my patients return to me with that little whisker and they say, it's worth it, they feel good, we'll manage it.
And it's not like you're going to get a beard, and nobody's going to know but that particular woman, and she can pluck and shave those, and it's not really a big deal. Acne, pimple here and there show up in about 80% of patients on testosterone pellet. So there's only about 20% of patients that really don't get any symptoms, side effects whatsoever. But the facial hair and the acne thing are very minimal. When we talk about it with women in our clinic, they don't even blink an eye about whether they'd want to stop versus continue with the side effects. The one that is more troublesome, though, is scalp hair loss or thinning. About 5% of our patients get that. So look at the data. 95% of women coming in here don't get that. So this is something women hear about. Either they're going to get a beard or they're going to lose their hair. Well, the statistics don't bear that out, fortunately. But 5% of the time they will get hair thinning, and it can be fairly significant. The good news is it's reversible. We can either lower the testosterone down from, if they're in a high range, to a medium range, or medium range to a low range, still keep it in therapeutic, and often we can get that hair thinning to stop. Or we can add a medication called spironolactone, which is a very common medication in the United States used for mild blood pressure generally, but dermatologists use it commonly in acne patients because what it does is it inactivates the enzyme in the skin where testosterone goes from an inactive and active state in the skin. Enzyme is called 5-alpha reductase. And so if our patients get significant hair thinning and we're not able to fix it by the known nutrients for hair that you can purchase at common health food stores, and or starting them, then that's when we start them on spironolactone, and it's usually successful to the degree they still don't want to stop the testosterone.
The biggest fear women have about hormone therapy is cancer. A lot of this is misinformation that's been restudied and reevaluated. The biggest thing women should know is that estrogen therapy does not cause breast cancer. What it can actually do is potentiate cancer that's already there. It can make it grow faster. The important thing is that your hormone specialist is checking to make sure your mammograms are normal and everything's healthy before we even start therapy. If everything's normal and healthy, you have no reason to feel that your estrogen will cause that cancer. If that were the case, every young woman in their 20s would have breast cancer.
Another interesting area as far as estrogen and testosterone use in the pellet form is the time that it takes from the first insertion to when they start experience symptom relief. With estrogen, it's quite rapid. It's about 2 weeks to 3 weeks. But the testosterone is a different story. During the first cycle, they generally will get a spike in the level of the testosterone because even though it's bioidentical, often these women have such low testosterone levels, for some reason, the receptors aren't seeing it. So it goes quite high, and the receptors start seeing it, and it starts coming down, and then at one point they're saturated, and we want that to be somewhere between 70 to 125 as far as their testosterone level. The very first cycle, they get a burst of symptoms, and then that fades away. And then what our patients tell us is that about 2 months after the second insertion, the full benefit comes on and it stays on after that. So now women are going back to their homes and now they have this great sex drive and this energy, and now the men want to come in and get checked.
I often recommend this as a couples type of thing because oftentimes it's the women that come in first. We're more in tune with our hormones per se, or we're more likely to come to the doctor for it. The women then bring in their husbands for the therapy. And I hear from husbands all the time that they had to come in because their wife feels so good, she's ready to go all the time, and they need to keep up with her.
So this originally started out as a female-only clinic. Well, today it's about 30% males because they found that they get better response too.